I'm Dr. Rejane Dillenburg, pediatric cardiologist from Canada. Before I introduce our keynote speaker today, Adrienne Kovacs, to the Alex McCormack Memorial Lecture, I would like to take a couple minutes to tell you who is Alex McCormack. Alex became my patient after more than a few days of severe systemic inflammation. A pediatrician referred him for an echocardiogram. And that's when I first met Alex and his family. The echo showed giant aneurysm on day 9 of fever. So that was a big shock. And he was treated and he recovered. And he remained asymptomatic. And as he was on anticoagulants, he was not allowed to play hockey. Hockey is a big thing in Canada. And all the other contact sports were out for him. Instead, he picked up a guitar and became a very, very fine musician. Many years went by, and all seemed okay, all seemed fine. We did not see it coming. He chose to end his life on June 16, 2012. At the age of 17. So now I'm going to read a note from Jennifer, Alex's mom. My Alex was very brave. He was cherished, deeply loved, and is terribly missed. The stigma that follows suicide is unjust and causes survivors timeless pain, guilt, and shame. Behind every suicide is a life story with important messages. Jennifer writes, I'm a KD mom and a suicide survivor. I have learned so much because of my son's life experiences, and I'm trying to grow from them. Alex was a Kawasaki disease pioneer, his journey ending in tragedy. I hope my son's story will help others learn and grow too. The Alex McCormack Memorial Lecture is a meaningful gift. Thank you for honoring Alex's memory. And now I'll introduce Adrienne to talk about facing and coping with the unknown. Thank you.
Hello, everybody. So, my name is Adrienne Kovacs, and I'm a psychologist in Toronto. I'm really honored to be here today giving this lecture. And Jennifer, Steve, Charlotte, and Carly, I hope I do you justice. No disclosures. I will say that I love my job. And in my job, I get to do clinical work, I get to do research, I get to give talks to doctors and patients and families, and this is my favorite thing to do. So I love it when I get to talk to the real people who Kawasaki disease impacts. So the plan for today, I'll begin with a very brief review of what we know from research about what it's like to live with Kawasaki disease. And the reason I'm giving a brief review is when we do research, we talk about generalities, but we talk about relationships and predictors and nothing guaranteed. So some of it may impact your own experiences and some of it may seem differently. So what I'll spend most of the time talking about are tips for you to help your children and adolescents and young adults cope with the unknown, and also tips for helping you cope with the unknown. So my hope is that you leave here feeling that you're a little more confident in your ability to manage this life. So very briefly, what do we know from research about living with Kawasaki disease? So once again, I'm talking about things as a group. So we know that children with Kawasaki disease have similar psychosocial functioning to healthy peers, though some studies have found elevated anxiety or emotional concerns. Children tend to have lower general health perceptions, which means they rate their health lower. One study found there was lower health-related quality of life for younger boys, but comparable to their healthy peers for older boys and girls, and that they do tend to be less physically active. Looking at teens, once again, and I'll talk a bit about quality of life in a few minutes, but that health-related quality of life is comparable to healthy peers. Though the older our children become, they have lower perceived health ratings, so they notice, they're more aware of declining health. And what about the parents? Well, they've looked at the health-related quality of life, and that tends to be comparable to those of parents with healthy children. This may resonate with many of you in this room today, but a higher perception of the children being vulnerable to illness. And Nita Chahala, the Toronto team, have looked at some sources of parental anxiety, so they did focus groups. And they noted that the time of diagnosis can be often very frustrating, struggle to find information. They describe an emotional roller coaster at the acute phase, so right at that immediate diagnosis and that treatment, the first few months. But then longer-term concerns regarding the longer-term outlook. And they also talk about changes in family lifestyle. In just the last hour, Nita presented some information some very telling information. She had interviewed 30 parents of children with Kawasaki disease, KD. And they all talked about living with uncertainty. And they noted greater illness intrusiveness. And what that means is the impact of the disease is intruding and interfering with normal lives. And illness uncertainty was associated with missed diagnosis. Fatigue and sleep difficulties were common. Financial and personal burdens, so less personal time, social interests, focus on personal and career goals. Family stress and lifestyle restrictions, and anxiety, which often increases around the time of medical appointments. Does any of this resonate with those of you here in the room? I see many nodding heads. So let's move now and talk about some clinical or strategies that can help you and your child cope with the unknown. And we'll begin by talking about ways for you to help your child. So just to begin, I think we're all very fortunate to be in attendance at the International Kawasaki Disease Symposium. This is an incredible opportunity for healthcare providers and scientists to work together to improve the medical outcomes of children, teenagers, and adults affected by Kawasaki disease. And I'm really honored to be here. And I'm really moved by the incredible scientific presentations I've seen earlier. At the same time, it's important to be mindful that the impact of Kawasaki disease can extend beyond physical well-being. It can also affect the psychological and social well-being of the patient and family. And I say at the same time because these are not mutually exclusive goals. We can focus on improving diagnosis and improving treatment while at the same time focusing on the quality of life. And patients are more than their medical diagnosis. So if we take a moment, what matters to teenagers? Is it only their Kawasaki disease? Probably not, right? So here are some of the things that teens care about, they talk about. It includes things like how they smell and how they're sweating, and they're developing relationships. They're developing an identity and trying to figure out who they are and what they want to be. I'd just like to take a moment when Dr. Brian McCrindle was letting me know that he was one of the organizers of this conference, and he knows I'm a psychologist. It wasn't me who came up with the idea of a talk like this. And in my dozen or so years of working in pediatric and adult cardiology, it's been very impressive to me and reaffirming to see cardiologists becoming increasingly aware and focused on the broader impact of living with Kawasaki disease and other medical conditions. So I'm really impressed with the transition in the movement and the focus on this in our cardiologists and our nurses. So what do we mean when we talk about quality of life? Have people heard that term before? We talk about it a lot, and even in the first presentation on Tuesday morning, there was an epidemiologist talking, and who said, in epidemiology, we focus on trying to prevent disease, treating it, and also improving quality of life. And I thought that was great that he included that right up front as one of the goals. So sometimes we researchers get this confused, but when we talk about health status, it's a person's subjective rating of their overall health and functional abilities. So, can I do things without getting fatigued? Do I have chest pain? Am I able to participate in sports? The health-related quality of life is a subjective impact of a person's health and treatment on physical, psychological, and social well-being. So how does an illness, how does a treatment affect somebody's life? And when we talk about quality of life, we're talking about somebody's overall life satisfaction, and that can be affected by health as well as health-unrelated factors. So when we talk about trying to help our children living with Kawasaki disease, maintain a broad focus on quality of life. So focus on that overall quality of life, not only health-related quality of life. So focus on each child's individual strengths, interests, and preferences. Foster positive social interactions with peers and siblings, and refrain from unnecessarily limiting social activity. So we want to help our young people live as rich and full a life as possible. Communication is so important, and this is true for your children with and without Kawasaki disease. So discuss favorites, hobbies, friends, schools, subjects, colors, foods. So we want to talk about things unrelated to our health. Ask them questions to help them maintain some control. What would make hospital visits better? So maybe we can't take away the fact that medical appointments and hospital visits will happen, but what can we do to make them better? Ask them, what are your questions or concerns about living with Kawasaki disease? Instead of saying, do you have any questions? They're going to have questions. Let them know that. And recognize the power of listening. So sometimes if we feel that we don't know what to do, sometimes just being heard can be very powerful. And consider a balanced approach. So first of all, model that effective coping by not letting the diagnosis define you. And model optimistic expectations. So hoping things, expecting things to work out. At the same time, acknowledge potential challenges. For example, you can say, I would imagine that this can sometimes be a struggle for you. Whenever you want to talk about the struggles, let me know. I'm ready to listen and help. Especially when we talk about adolescents, they're going to have questions. They're going to have concerns. That's what teens do. It's normal for them. Let them know that you understand that there will be some challenging moments and you're ready when they want to talk. Some of the challenges of adolescence. So this is a time of significant cognitive, emotional, and sexual development. Identity formation happens here. So this is where people are figuring out who they are and who they want to be. There's a sense of personal uniqueness. So nobody else has felt this way before. There can be a sense of invulnerability. So this won't happen to me. Adolescents tend to focus on more short-term outcomes rather than thinking long-term about things. And the time when we begin to transition patients to take increased responsibility for the healthcare management, or the time when we may actually transfer them to adult care, that's the time when they're most likely to consider themselves invulnerable. So it is a tricky time. And in the media lately, there's actually an increased focus on adolescents. Time magazine, National Geographic, a lot of books come out, and we know that being a teenager is a unique opportunity to experiment with the world, ourselves, and other people. It's a unique time, it's a wonderful time, and it's also a very challenging time. So one of the things we also want to do is allow your children to grow up. Accept that their interests will change as they grow older. So what interested them when they were 8 or 10 may not be the same things they're into as teenagers. Support and encourage the transition toward them becoming increasingly responsible for their healthcare management. Encourage them to speak on their own with their healthcare providers. When I talk to doctors and nurses, I actually encourage them, beginning around 12 or 13, to have a portion of every medical visit where they talk to patients on their own. And that way the young people get used to communicating directly with their healthcare providers. And that way, if a question comes up that they want to ask the doctor, they know that, and they don't want mom or dad to be in the room, they know they'll have that opportunity at the visit. They're going to make mistakes, we all do, and the goal is to learn from them. Consider the siblings. So consider the demands of the illness as well as more acute situations. So it can be challenging for brothers and sisters when somebody goes into the hospital. Address their questions and concerns. Once again, they assume they will have questions and concerns. Encourage and don't restrict their involvement in healthcare situations to the extent to which they feel comfortable. So let's switch gears to talking about tips for helping you as parents cope with the unknown. And know that many of these are overlapping tips and they apply to both children and adults, but for now we'll focus mostly on the parents. So here are some reactions to caring for a child with Kawasaki disease. And I talk about, here's a list of some of the emotions that some parents sometimes describe. And that's because I can't stand up here and tell you this is how everybody reacts. This is how people feel. I don't think I've ever met people who have reacted to the same way to any situation. But here's some of the more common concerns. They may describe being angry. Maybe at the time of diagnosis, they may be angry at healthcare providers or angry at the way they manage situations. They can be confused, uncertain, overwhelmed, stressed, sad. They may feel guilty or regret some things. They might be tired, misunderstood, feel alone, and they worry if and when something bad will happen. And here's a list of some other things that parents describe. So pride in the achievement of their children. Satisfaction when things go well. Joy at spending time with their amazing sons and daughters. Gratitude and appreciation for the time that they enjoy with their children and for the support of their healthcare team. Knowledge of the important things in life. So people often say, I actually know what's important in life. I know what I want to do and who I want to spend time with. And increased compassion and tolerance. So, I realize there are some people from Hawaii here. Many of us flew in. What are the airplane instructions for using an oxygen mask? What do they say? Put your own mask on first. And why do they say that? Because if you're not taking proper care of yourself, it's difficult to take care of your child. Okay? We often neglect ourselves when we're trying to take care of other people. We do better for ourselves when we take care of ourselves, and we can be better parents as well. So when we talk about self-care, physical health is important. Good nutrition. Avoiding smoking and excessive alcohol use. Physical activity. It's great for physical well-being, but it's equally as important for psychological well-being. So they've done thousands of studies by now. And regular physical activity can help reduce depression and reduce anxiety and help us manage stress better. Doesn't matter the intensity, doesn't matter what you do, just moving, even if it's a 10-minute walk, can make a lot of difference. Make sure you're taking care of your own health and you're not neglecting your own checkups with your doctor and dentist. Focus on sleep quality and quantity. And undergo regular screening as recommended for people in your age category. Your children want you to take care of yourself. But self-care also includes psychosocial health. So nurture and maintain supportive relationships with your partner, family, and your friends. Reach out and have a focus on you getting the social support that you need, particularly in challenging times. Be direct with your friends, so let them know what you're looking for. If you're going to talk to them about a stressful situation, be upfront and say, I'm going to talk to you about something and I'd really like your advice. Or, I'm going to talk to you about something and what I'm looking for is a friendly ear. I'm not looking for your advice, I just want somebody to talk to. Schedule time for personal hobbies and interests. So plan things that you like to enjoy. And say no to things that you don't want or don't have to do. It's okay to get a little protective of your time. And the idea is that you're not just taking time for yourself, but you're making time for yourself. Distraction. Oftentimes people will think, well, distraction is bad. I don't want to do that. I should focus on things. Distraction is not the same as denial. Denial is ignoring a threat. Distraction means deciding to take a break from focusing on it. So we shift attention to another interest and away from unnecessary focus on threats. So it's planned and proactive and purposeful. So if anybody in here gets a little afraid when they fly, you take things to distract yourself. You take books or magazines or puzzle books. If you get nervous the days before a doctor's appointment, figure out what you can do in those evenings so you're not sitting at home worrying. If you get nervous when you're at the medical appointments in the waiting room or during hospitalizations, take something to keep yourself busy while you're there. Problem solving can help, but worrying in and of itself does not change the outcome. If worrying was going to change things, I would prescribe it. So if you're worrying about your child's health outcomes would change health outcomes, I would say spend an hour a day worrying. It's not going to be an effective way to use your time. So we can challenge our thinking. When you notice that you're having some automatic negative thoughts, and we call them automatic because they come right away. We don't actually think, well, I'm going to think negatively about a situation. It tends to crop up. These are some questions to ask yourself. Is this way of thinking helping me or making me feel worse? Am I making assumptions or jumping to conclusions without evidence? So people often try and behave as if they're fortune tellers. So let's acknowledge that we can't predict the future, but maybe we want to look to get more information. We can ask ourselves, am I looking at the big picture? Or is there a more balanced way to think about the situation? So the next one's really important. What would I tell a good friend in this situation? If I'm feeling really, really nervous about an upcoming medical appointment, if a friend shared that same concern with me, what would I say to him or her to reassure them? Sometimes we're kinder to our friends than we are with ourselves. So think about what we would say to a loved one in that situation. We can also ask ourselves, am I focusing on something that is out of my control? And in the struggle for control, so oftentimes young patients and families will say, I have no control over this. And certainly there are some health-related factors that we cannot control. We can't change the body we were born with. We can't change any previous diagnosis or the circumstances which they occurred. We can't change any previous treatments we've had. We can't change the body we have right now or any planned future treatments. So yeah, those are health factors that we can't control. But here are things within our control. Keeping up with regular medical appointments, taking medications as prescribed, maintaining a healthy lifestyle, which includes exercise and nutrition. When we go to medical appointments, asking questions when we have them, and providing information to the medical team. So we get information and we give information. We are active participants in our healthcare, and also seeking urgent treatment when necessary. So on that right column, we can see there are health factors that are within our control. And also we want to focus on the health unrelated factors we can control. We can decide with whom we wish to spend our time. We can focus on the quality of relationships with our family and friends. We have control over our focus on school and career. We get to decide what activities we do, what hobbies we want, what interests we have. We get to decide how to schedule our free time. And we get to think about and make future plans and goals. A few more words about control. Accepting that there are things we cannot control can be helpful. This doesn't mean we like them, so we can accept things and still wish that they were different. Sometimes I talk to people who say, I will never accept it because it means giving in. It doesn't mean we have to like what's going on, but accepting it means we actually get to live with reality instead of fighting where we are right now. Once again, worrying about things doesn't change the outcome, but it can certainly make us feel worse. The goal is to live as rich a life as possible. So avoid going through the motions. Sometimes people will say to me, every day, every week, every month, every year, it's the same thing over and over again. So we want to be mindful of the joys that life brings, both small and large. So celebrate the successes in your children's life. Small things, so we're here in beautiful Hawaii, so enjoy the feeling of warmth on your skin if you're from a cold climate like I am. Be mindful of that. So acknowledge and pay attention to the joys that life brings. Decide what brings you the most joy and satisfaction in your life and make these things a priority. So we don't want Kawasaki disease to define the lives of our children or of us as family members. Figure out what brings you and your family that joy and satisfaction. And on a regular basis, perhaps a monthly basis, schedule time to check in with yourself. So oftentimes when I'm working with somebody, we might finish a course of talk therapy. And at the end, what we say is, put it in your calendar on a monthly basis that you take time to check in with yourself and you see how you're coping. Look back on the previous month and say, how was I doing? What was my anxiety or stress level like? How did I handle things? Did I have fun? Were there things that brought me joy in the past month, or was I maybe too focused on work? So check in with yourself to focus on what your priorities are. And first of all, and I say this because this applies to children, adolescents, young adults with Kawasaki disease, our family members, and everyone in this room. When things seem too difficult to manage on our own, consider professional help, and that might be a psychologist like me, a psychiatrist, a counselor. I think assessment is important to learn whether concerns and coping challenges warrant clinical attention. So sometimes people don't know. I feel like I'm struggling a little bit, but I don't know if I'm dealing with true anxiety or a little bit of worry. You don't have to figure it out. So you can talk to somebody to figure out what you're experiencing and if that warrants clinical attention. Intervention. So you can learn strategies to help you cope better. So to reduce stress or anxiety, to improve mood. And it can be really helpful speaking with somebody not directly involved in your situation. I often talk about this as the breakfast table example. So when somebody comes to talk to me, they can be really honest about their concerns. They can say whatever they want, knowing that I'm not going to judge them, and I'm not going to hold it against them when I see them at the breakfast table the next morning. So I think it's important to recognize that as wonderful and as supportive as family members can be, sometimes it's helpful talking to somebody who's not related to you. In conclusion, so going back to this, so health status, physical symptoms, physical well-being, is one of many important things to your children, but the goal is for this not to define them or the family. When we talk about health-related quality of life, it's important to understand the broader impact of Kawasaki disease on psychological and social well-being. And that general quality of life, we want to optimize the overall life satisfaction of your children and you by also focusing on and celebrating and enjoying things unrelated to health. And I'll leave you with a final quote. In Canada, we have a Governor General, and that's essentially our Queen's representative in Canada. And a few years ago, her name was Adrienne Clarkson, and we share the same first name. She has heart disease, and she wrote a book published in 2007 called Heart Matters. And she opened by saying, I have a tricky heart. I believe now that the important thing in life is not knowing how many heartbeats you're going to live, but deciding how best to live in between those heartbeats. We absolutely want to extend the lives of children affected by Kawasaki disease. And I think at the same time, so not in any conflict, we want to figure out how to help them and you live as rich a life as possible. And thank you for your attention today.